still ahead. How to treat scoliosis in adults. Stay with us.
When you hear a diagnosis like scoliosis, you make it concerned, and rightfully so. But today, we're going to talk about treatments and hope that's going to make you feel a lot better. Joining me today is Dr. Lisa Corsa, along with her friend, Sally, who doesn't really need a lot of introduction. She's just a skeleton.
We love her. I love Sally.
We love her. That's her title. However, I have this piece of paper because she has a lot of titles. Physical therapist, manual osteopath, and athletic trainer of Premier Therapy Solutions in Boca Raton. Wow. You do a lot of things.
Yes, I do.
But you do a lot of things, which is fantastic for those that come here and are suffering from back pain. Today, we're going to talk about scoliosis. So first, let's just dive into what it is.
So scoliosis is an abnormal curvature of the spine.
So let's use Sally as a little, example.
Right. So you have three curves in the spine: the cervical curve, thoracic, and lumbar. With scoliosis, you could either have a C curve, the spine turns into a C, or the letter S.
Right, which is the one that most common we see.
Correct.
All right. There are two different types of scoliosis, doctor?
Yes. There is structural scoliosis, and then there is functional.
What is the difference between both?
So structural is more of a congenital. You might be born with it. A lot of girls, teens, kind of 15-year-olds, 16s, you'll start to see as they grow, the spine starts curving.
All right. Do you feel anything, doctor? Do you have symptoms?
The problem is you may not have symptoms. You must go to the pediatrician and get your spine checked.
So are there symptoms that one feels when they have, let's say, that S forming?
You may not feel symptoms, so you do need to get checked for your yearly physical with your pediatrician. However, you certainly could have back pain. That's probably the #1 trigger: pain, complaint in my back, sitting for a long period of time, it's hurting.
And when you say back, the first thing I think of, and I know you have a daughter, and we're going to talk about the personal story of hers, but a lot of kids are wearing these heavy backpacks, some purses that are really heavy. Does that kind of lend to the problem?
Absolutely, Olga. For sure, that's one of the primary causes of scoliosis. They're holding these backpacks on one shoulder all day long. They're reading or holding an iPad on one arm. So a lot of those are just positions that you stay in, and eventually the muscles shorten and cause the bones to turn.
Which happens over time and you don't realize it's happening. You saw something happen to your daughter, and because of her scoliosis, all of this came to be. Tell me your story.
Right, so she started developing at age 10. I noticed the hip was changing. So one of the things you should look at is one of the hips were higher. So, and she started to complain of night pain when she was growing. So growing pains is common. Took her to the pediatrician, we got the x-rays, we did a special test, and we were definitely confirmed she had scoliosis.
All right, and how did you treat her? How did you take care of it? Because I know you took, I think it was John just a few minutes ago, to show us some of the treatments.
Absolutely. So there are multiple treatments we can do for scoliosis.
Let's talk about a few that you showed us just a few minutes ago. Let's show that video, and I think one was first on the floor.
Correct. Stacy is on the floor doing a nice, real good lengthening stretch of her spine. Just lying flat down, pulling her arms over her head, stretching out her legs, and really lengthening up the rectus abdominis, the muscles of the stomach that can cause compression from us sitting all day.
And how is that helping her?
So what she's doing is holding it, stretch the muscle, which actually pulls and stretches the bone, puts it all back into place.
All right, I know we used, I believe it was some sort of Pilates machine.
Correct. We also have a reformer here that you will see Stacy working on, where she's strengthening some specific muscles that support the spine. Those are the gluteus maximus. The gluteus maximus, the minimus, and the medius are the primary spine stabilizers that need to be strong. So Stacy's doing some glute exercises as well as some leg press exercises to keep the spine lengthened. Pilates is a great exercise.
That's a fantastic one. Yoga too, right?
Absolutely.
Yeah, that's another good one. You had Stacy do another one, didn't you?
So yes, I have a special room called Schroth. So if you are diagnosed with scoliosis at a young age, you should look up a Schroth scoliosis practitioner. They are specialized in treating scoliosis, and it is a non-surgical approach using a Schroth ladder from Germany.
Fantastic.
So Stacy's showing some exercises here There's a multitude of them, but she's showing some exercises of lengthening the spine and strengthening the muscles of the back that support the spine.
Now let's go to John, because I know there's a John, right?
Correct.
John did some sort of contraption, let's say, and he was to the side. What were you doing there?
So John was on our Pilates barrel. So with a curve or scoliosis, usually one side is compressed and the other side is lengthened. So we lay him over the lengthened side so we open up the compressed side. And that needs to be instructed by a physical therapist. Do not do these on your own. You do need a formal evaluation to make sure. So we saw which side of his spine was curved and we're stretching that.
All right, and I know he used this one back here as well, which I am tempted to try because that looked like a fantastic stretch.
Absolutely. Everyone should do a hanging pull every day. You grab on a bar and you pull your body and you hang there for 1 minute. You're opening up the vertebral spine, stretching all of the segments of the back, and it's wonderful for rehydrating the discs.
All right, now that we saw a few of the treatments, there's something else that you do here, which is like a full body exam. What is that?
So it's called my full body musculoskeletal evaluation. Like everyone goes to the doctor for a yearly exam.
Right.
We go for a yearly breast exam. Men go for prostate exam. Why are we not going for a yearly musculoskeletal exam? I literally look at every muscle, bone, ligament, and all of those soft tissue structures to see if you're in balance.
All right, is that something that you could actually show me how you would do?
Absolutely.
All right, show me what you would do in
So-
terms of, obviously you're not going to be taking all the time, but kind of maybe minimize it.
Correct. So normally I would have you in your sports bra and your underwear, and we are actually taking rulers and measuring the scapular bones, and the height of your shoulder. Is one higher than the other? Is one hip higher than the other? I would actually be drawing on you with pen and markers to measure the specific folds, the gluteal fold, the popliteal fold, the heel bones. Do you have one leg longer than the other?
So you're actually really, really honing in on every single angle.
Correct. Then we test the muscles for asymmetry. Is your bicep stronger than your tricep? Is your quadricep stronger than your hamstring? And then I'm actually giving you a prescription that says, strengthen this exercise, don't strengthen this one. Lengthen this muscle, stretch this one. And it's very specific.
It's really important to really hone in on scoliosis and diagnose it correctly. Doctor, what are the repercussions if you just let it go?
Correct. So if you let scoliosis go, you may end up needing surgery where they put rods and pins.
And that's the last thing we want.
Absolutely last resort. You do not want that. But there are some women that are born and congenitally, the degree is so bad, worse than 40 degrees, they really do need rods and pins. Or you can do bracing. There is bracing.
Okay.
Thoracic spine bracing, they make a special brace for you, and you can have that as well.
But to wrap it all up, I know you've had a lot of people come in saying, I'm looking at surgery, and I know you've helped them even before they had to walk through that operating room, right?
Correct. I think it's imperative you see a physical therapist pre-operatively. You should not go right into surgery.
Agreed.
You need to have the muscles lengthened and stretched and strong prior to going in.
Thank you so much for all the great information. And I have to thank Sally.
We love her. She's my best friend.
She's from Germany?
Yes.
She was a gift?
She was a gift from one of my patients.
Oh, that's so nice.
Love her.
And how is your daughter doing, more importantly?
She is doing wonderful, thank you. We have really gotten her scoliosis under control.
Fantastic. Doctor, thank you for inviting us.
Appreciate it.
Thank you for your time.
Up next, living with a family member who is on the autism spectrum. Our expert gives us some helpful advice.
You're watching The Smart Life on the Health Channel on South Florida PBS. If you'd like to learn more, please visit the Smart Life page on our website at allhealthtv.com. If you have a question for our experts, please visit the Ask the Experts page or give us a call at 855-796-4475.
Don't forget to download the Health Channel app. It's available free at the App Store or on Google Play. Follow us on social media at All Health TV on Facebook, Instagram, and Twitter.